Namaskar. Okay, welcome everyone. Here we have Dr. Katy Ehmann of Ehmann Dental Care in Annapolis, Maryland, and we're going to talk a little bit about oral hygiene because this month of May 2024 we are involved in the Dental Challenge. And why not hear from a veritable expert and our very favorite dental yogi here in Renaissance Yoga community. So welcome, Dr. Ehmann. Great to have you here. Thanks for joining in.
Thank you so much for letting me participate, Satyam.
Sure, wonderful. So we're just going to go through a couple simple queries. Just in general, what do you see in your practice? What are the most common issues, even for people who are sincere and conscientious in their oral hygiene? What are the issues that you find with people who come into for general checkups?
That's a great question, Satyam. They're pretty varied, but a lot of my patients, as everyone ages, our face muscles sort of push and change our teeth structures over the years. You think they don't change, but everything sort of collapses in and tucks in. So even if you had straighter teeth when you were young, a lot of times they can change and your face still continues to grow through your lifetime. So sometimes teeth become harder to clean and there's problems in clenching and grinding. So despite good hygiene efforts, you can still have teeth that break or get worn and need treatment just from the variableness that they're in our faces and our mouths for a long time, for decades and decades, maybe more than they were meant to be. So we try to maintain everything and everyone's living longer. So we try to set people up for success for the future.
Wow, very interesting. So it's not just a typical little bit of plaque here and there, but it's really a holistic range of issues that people may be dealing with.
Yeah, very much so, because we can usually try to work on plaque and decay prevention and hygiene, which we always do every time. But there's some reasons that teeth fail or they break, and I'm always trying to get down to the reason why things are happening. If you're having trouble, we talk about the reasons why and try to preventatively talk about what we can do about those things so that when you're older, your teeth can be more trouble-free. And so to treat things earlier takes some hard discussions sometimes because some things we can't change very easily. But we try.
So what are the things that you feel people can do on their own proactively to help prevent and keep at bay any of these oral issues that they may come that crop up?
Very standard, good oral hygiene habits and good routines, which I hope a lot of our yogis have with them. Good nighttime care and just really good plaque control when you can do it. Patients who have gum recession over years from keeping your teeth, sometimes you need to come in a little more often for us to help you. And then also a lot of clenching and grinding that can happen when you're sleeping. You need to protect your teeth. And then we talk a lot about, as you know, airway maintenance, because a lot of times, sometimes people are clenching their teeth at night because they can't breathe well. So we really talk a lot about sleep apnea, breathing comes into play as well. And then protection on that scale to try to prevent any problems that can become pretty severe later.
I see. So it's more than the usual brushing and flossing, which people should brush.
Yeah, you have to do that anyway. And that's non-negotiable. So those good nighttime routines of brushing, definite flossing, water picking sometimes, those are non-negotiable. Those have to be done. And then if other things are happening, we try to set people up for success in the future.
And generally we find that the Western world has really been the forerunner for oral hygiene. But one thing I found in the Eastern world, and now it's becoming more popular in the West, and I don't know what the science is of it, is the tongue scraper. Is that something worthwhile, or what's?
It is in certain people for sure, especially a lot of like long-term coffee drinkers. Your tongue's kind of like a shag carpet and can really harbor a lot of bacteria. Some are bad, some are good. But cleaning your tongue can absolutely help you at nighttime, especially bad breath issues and especially with diets and patients' medications. If your mouth is dry, those can all affect things, but it can absolutely help as well. And a good diet, which you are a huge proponent of for sure. Good diet, plant-based diets particularly are better for tooth health with non-decay causing bacteria. So good diet, anti-inflammatory, foods and other health routines can also help because your mouth is a huge window into the rest of your health, heart health, everything else as well.
That's interesting. Sometimes people think of the teeth as being completely independent,
Not me. I know it's my life's passion,
Yeah,
but
I know, it's
yeah,
interesting.
we're so lucky to really. I practice preventative health with patients my entire career, and we are so lucky to see patients all the time. I get to see patients every 6 months or more, their whole families for decades, and it's just a gift. So we can really see how people are doing because we get to see people a lot of times more than their primary care doctors and spend more time with them to really say like, oh, something's slipping. What's going on with you? And I really get to talk to them about, is something going on we can help with, life events. It's really special. So I
Really
hope that
wonderful.
if they become comfortable enough to talk to your dentist about that, we can try to help.
Yeah, it's great. It's not just oral care, it's really overall
Mhm.
care. Yeah,
Correct.
interesting.
As some of our Renaissance yoga community knows. So
Yeah,
yeah, it's really important.
nice, wonderful. Any closing thoughts or closing advice for us?
No, thank you. I just want everybody to know if you ever have some weird circumstance and you ever need me for a question or help, I'm always here to help. Even if it's my advice is I don't know, you need to come see somebody. If anybody has something going on, just offline that they ever wanted to contact me about, I would always be welcome to speak to someone.
Oh, well, we
Because
greatly,
education is very helpful. Not knowing is what's scary.
wonderful. Thanks so much, and thanks for your availability and availing yourself as a resource for us. All
Thank
right,
you so much for everything you do, Satyam. Personally, you make my life better by practicing yoga on my non-ergonomic profession. So I thank you so, so much for all these years of
great
care.
practicing with you. Okay, stay well. Thank you so much.